The prohibition of drugs began in this country in 1914 with the Harrison Act. That was directed at doctors, and it regulated opium and opium derivatives and cocaine. Excuse me, largely because 1.3% of the population was said to be addicted to drugs at that time. Then, years later, in 1970, as we heard, President Nixon established a committee to study the effects of marijuana and make recommendations for an appropriate drug policy. 9 of the 13 members of the commission were appointed by President Nixon, but when he found out that the commission was going to recommend decriminalization of marijuana, he rejected the report. He said he wouldn't follow any recommendation to legalize marijuana. And every president since Nixon, Democrat and Republican, has escalated the war, despite voter polls and local laws showing they should do otherwise. In 1972, justification for rejecting the Commission's recommendations and for continuing the war on drugs included the fact that the addiction rate was about 1.3% of the population, just as it had been in 1914. Shouldn't that percentage have gone down, at least some, as a result of drugs having been illegal since 1914? Shouldn't there have been some indication that banning these substances had reduced use, reduced addiction? How prevalent is drug use? The number of people in the U.S. over the age of 12 who had used illegal drugs in 2005 was about 112 million, about 46% of the population. This is the number of people who had used illegal drugs, not the number of addicted people. And in fact, this may shock you if you've forgotten about it, the past 3 U.S. presidents have tried marijuana, according to news reports. The reality is, Americans want their drugs. Not all Americans, but a sizable number. And Americans will have their drugs, whether legal or illegal. Make no mistake about that. Americans are the largest consumers of illegal drugs in the world. Americans are the largest consumers of cocaine from Colombia, much of it brought up through Mexico, heroin from Colombia and Mexico, marijuana, ecstasy, and methamphetamine from Mexico, etc., etc. And let's look at some of the costs of the drug war. Our highly respected senior lecturer in economics at Harvard, Jeffrey Myron, says that federal, state, and local governments spend roughly $44 billion a year to enforce drug prohibition. He says these same governments forego roughly $33 billion a year in tax revenues, assuming drugs were legal and taxed at rates similar to those on alcohol and tobacco. Under prohibition, these revenues are profits for illegal drug traffickers. And I have to point out that although the current administration has shifted anti-drug rhetoric away from the war on drugs metaphor and started talking about drug abuse as a public health problem, one that needs a balanced policy response, the change in rhetoric hasn't been accompanied by any change in policy. States that have enacted medical marijuana laws have found themselves in trouble for violating federal drug laws. So, despite the incredible increase in costs, federal spending has increased by more than 1,800% in the past 20 years. The war on drugs has failed. We know that the war on drugs will never work, no matter how much money we throw at it. Other countries have decided they no longer are willing to fight this unwinnable war on drugs. In the late 90s, drug abuse had become a significant and seemingly uncontrollable social problem in Portugal. So Portugal passed a law decriminalizing all illicit drugs for personal use, including cocaine and heroin. The drugs are decriminalized, meaning they're not legal, but violations are considered administrative, like traffic tickets, rather than criminal. Instead of being sent to criminal courts and prisons, users are sent to counseling and, when necessary, treatment. No criminal record. Despite loud warnings to the contrary from drug war hawks, usage rates dropped substantially for virtually every substance among the critical age group, 13 to 18-year-olds. They're happy with the results. Switzerland gives us another example. In the late 80s and early 90s, Switzerland faced an intense problem with drug abuse, particularly heroin abuse, along with increasing numbers of HIV/AIDS cases as a result of illicit drug use. In '94, they developed an experiment to treat heroin addicts with government-manufactured heroin. The program was a success. I'm running long, so I'm going to tell you, we want drugs legalized, regulated, and taxed. We're not advocating a free-for-all, anything-goes approach. I hope you will agree with me that drug abuse is a private matter and drug addiction is a public health matter, not a matter for criminal justice. If you want to support the work we do at LEAP, go to our website, leap.cc, leap.cc. New members can join. We've got to end this war on drugs. We've got to end this war on people who use drugs. And we've got to try a better, smarter approach. Legalize, regulate, and tax. Thank you.